Thanks for tuning in to the Drive On podcast, where we are focused on giving hope and strength to the entire military community. Whether you're a veteran, active duty, guard, reserve, or a family member, this podcast will share inspirational stories and resources that are useful to you. I'm your host, Scott DeLucio, and now let's get on with the show. Hey everybody, welcome back to the Drive On podcast. Today, my guest is Dr. Pamela Hall. Dr. Hall is a forensic and clinical psychologist and a subject matter expert in post-traumatic stress disorder. She's on a mission to get the facts about PTSD into the hands of veterans and their families. And Dr. Hall has written a book, PTSD Unplugged, How to Leave the War Behind Us, which is a guidebook for combat survivors and their loved ones. So welcome to the show, Dr. Hall. Why don't you tell us a little bit more about yourself and your background?
Well, thanks, Scott, for inviting me on to your program. I really appreciate it because, that is the mission, is to really get the real facts about PTSD into people's hands. So my background is that I have a couple years on me. And when I first got into my graduate training, it happened to be the year after this diagnosis made it into the diagnostic manual. So prior to that, I had watched my older cousins return from Vietnam in the 70s, and saw the struggle that our families had with how to be helpful and how to embrace, their homecoming and amidst the political turmoil, which always kind of comes along with war. So when I saw this diagnosis description that fall of my graduate degree, I thought, well, that's what we were looking at. That's what we were seeing. And so fast forward, 40 years, and PTSD has come in and out of my work for the first 20 years quite regularly, until I worked at the VA for a doctoral internship in the mid-90s. And so that was the first time I really dug in and started hearing from people about their Vietnam experience in particular. And it just struck me how vivid the memories of war were, despite that we were already 20 plus years since they had been deployed. And of course, I knew nothing about words like deployment or MREs or anything like that at that point in time. I knew about beer and alcohol, but I didn't know. There was so much about the military experience and the veteran experience that I had yet to learn. So that was a pivotal year for me of recognizing the long-term effects of PTSD, at least the long-term effects without any effective treatment. So from there, I went into private practice, and like they say, the long story short is that I worked with people one at a time, trying to be helpful, talking about how they were managing symptoms, and yet still seeing that this memory of trauma would come into the room. And once the memory of what had occurred was in the room, there was nothing else that we could talk about except for what happened. And this was before, or while, I guess, research was being conducted about how to be helpful with those things. So it was really my clients who taught me what was helpful. And by and large, what was helpful was a smart pacing of a discussion of what happened. Pacing meaning, you can't you can't chew the whole thing at one time. You have to take bites and work through each bite of what happens or what comes up in memory. And so from there, another 15, 20 years went by, and I was happy to see that what I was learning from my clients was what was coming up in research. And so I kept working in this area. Seemed to be an area that I could work with very well. coming around to 2008, I was approached by QTC Management, which has been a premier disability evaluator for the VA for several decades, a couple decades even before I started working for them. In 2011, we were starting to get a lot of claims from OIF, OEF, combat deployed folks, as well as sort of the start of the military sexual trauma evaluation process with the VA. And so they asked me to come on more. So I did. And eventually I was working 3-4 days a week in clinics across the greater Los Angeles area, talking to anywhere between 4 and 6 veterans a day about their experience in war, whether they were having symptoms associated with those experiences, and whether there was a service-connected condition, which I know your listeners will be very familiar with what that means. So that I was that person doing VA psychology benefits examinations for many years, and at this point have done over 6,000 exams. So just hearing that pattern of symptoms and the long-term effect of these symptoms has really brought me to this point, brought me to the point of writing the book. But that's a bit of my background in as short a summary as I can give you for today.
Yeah, well, I appreciate that background because it does help kind of set up, who you are, what your experience is with all of this. And, I like that you were saying that the things that you were seeing in your clients were also some of the things that were being validated by some of the research that was going on. And, it is a big thing to take a bite out of, right? Like if you try to just dive in and take the whole thing down in one bite, you're probably going to end up choking on it, right? But it's like there's
a lot of choking went on before we figured out. But the clients were patient with me as we were at the beginning of things. So in a way, it was exciting. They wanted relief. And so we learned together what that meant to take bite-sized chunks of horrible events and process them a bit. Yeah.
And there's a saying, how do you eat an elephant? And the answer is one bite at a time. Like, it's this big thing that if you want to eat it, you're going to have to do it one bite at a time. You can't take the whole thing down at once. And in this case, the experiences that they've gone through are the elephant, right? So
absolutely.
So I'm someone who has experienced PTSD firsthand in my own life, and I've known other people in my life that I served with, I deployed with. They've suffered from it as well. And personally, I suffered unnecessarily for a really long time because I never thought that I could be the person who was affected by it for some reason. I don't know why. It's just I don't know, maybe it's my ego or whatever. But for the longest time, I thought to myself, that's just the things that you hear about in the news. It's the thing that happens to other people. And it actually wasn't until a few years ago that I was formally diagnosed with PTSD. And so I guess all of that is me setting up my first set of questions for you. And that's really talking about what PTSD is and like who it affects and how does someone know that they might even have it? What are some of the warning signs or the symptoms that they may experience?
Well, just bouncing off of what you said just a minute ago, how long it takes for somebody to come to a realization that something is going on that's outside the normal. So, when it comes to PTSD, really, even including now, the picture we have of PTSD is a severe one. And people don't identify with that severe look at what PTSD is. So in the book, I take several chapters to talk about what I saw the most frequently occurring in the veterans that I was looking at. No matter what the trauma was, the symptom set or the way that it affected their lives was not severe, in the sense that they never ended up in the backyard holding a stick thinking it was a gun. So how could I have PTSD if that's not what I'm doing? So I began to learn. Again, you learn so much from the people who are enduring the symptoms, So I learned from them what it looks like to have mild to moderate PTSD. That's kind of how I frame it. So what is that? First, it's the presence of a memory that won't let you go. The past that is a moment in time, frozen in time. This concept of trauma memory. So if you look at our diagnostic manual, which people don't like very much because, but that's my filter. And the diagnosis has been upgraded and changed over the years such that it makes a whole lot more sense to me now as it is written than it did at the beginning. But the number one criteria of that diagnosis, and this is how you start to wonder whether this is affecting you, is exposure to a situation that is life-threatening, violent, horrific, or all three of those things. So those kind of moments in the moment take us out of whatever our daily routine was like at that point and shoves our brain in a second into survival mode. And so just even looking at your past, for anybody to look at what they've experienced in the military or outside the military, it's these kind of events that shove our brain from calm, peaceful, dealing with, coping with crap in life to all of a sudden fighting for life, fighting for survival, my survival or survival of other people. And so this, we experience these things, and not every time we experience these things does this happen, but sometimes, in some cases, that survival mode that gets started in the brain doesn't stop. And in these kinds of cases, what we see is that moment in time gets frozen in time and then can be activated by stuff going on around us and push us right back into, let's say, war zone survival mode or assault survival mode or, horrific event survival mode. There's so many accidents that can happen in the military that push people into that brain mode. So the number one thing to look at is, did I have events like that? Are they still bothering me in terms of vivid memories that seem to either come out of nowhere or get activated by sights, sounds, smells around me that eventually become predictable to me, and I start avoiding those things? And so then once you recognize that, then you can see how that memory being activated is affecting how you're dealing with what's going on right now. And so it's the what's going on right now that people usually look at as that's PTSD. But really, what's PTSD? Trauma memory and the way the brain is affected by trauma memory, and then how we behave because our brain is activated. Does that make sense, or can I clarify?
It does. I think it does. And I like that you described it with that traumatic memory, the trauma memory, that life or death situation, the violent, horrific situations, right? Because sometimes we're not really sure, like, what would cause that type of behavior. Maybe I never saw someone die right next to me, or I never killed somebody myself personally, or I never did X, Y, or Z. But you could have still, been a part of a situation where, there was a potential for that violence, and you could have had those situations, and so your brain probably goes into the same that same mode, that survival mode in any of those kind of situations, right? So I think I wanted to set that up first for the listeners, because I know from my experience, it was one of those things for me where I just never really thought that this could be something that I'm dealing with. Like, how could that happen to me, right? How, it just didn't seem to make sense. But it can happen to just about anybody, really. Nobody's immune from it, and so I think it's good to kind of have that baseline, to have that understanding of what it is, and how it could be triggered in your brain during some of these traumatic events. Whether you personally experienced a trauma or somebody else, or you just witnessed it from a distance, it could still trigger some of these
this is the greatest evolution of our understanding of PTSD, I think, over time, is and it's reflected in the criteria, if you will, about what could create this kind of trauma memory situation, so that now we're seeing there's three big categories. One is direct, it was me and mine who were impacted. The other is I'm watching this happen to other people. So, I just think about the guy or gal standing duty and witnessing, so content warning, trigger warning here in this conversation, witnessing an IED explosion outside the camp,
right,
or down the line in the convoy, or going on a rapid response team to an event that occurred at a civilian location, or back home. It could be something like this tragic event that happened at the end of Hell Week a couple of weeks ago, that cost another one of our service members their lives. So I think once you're sensitized to these ideas, you pay attention when you hear about things that are happening. And one of the misconceptions of the civilian world is that, maybe PTSD can happen if you're in a combat situation in the military, but not other kinds of situations. And even vets and service members make that kind of a judgment or it's misinformation is what it is.
Right.
Because now the third aspect, or the third big grouping of what can lead to this, is if you are in a first responder position, where time after time you're going into crisis events and you manage each one without any trouble, and then all of a sudden there's something that gets you. And again, you can tell it's getting you because it has pushed you into survival management mode. And so now we have these three groupings of trauma events that can occur. So that, say, in the past, we might not have thought of a medic experiencing a PTSD condition because that medic worked on base in, base hospital. And yet what we know is that medic can be just as vulnerable to this happening. So by virtue of the treatments that are the injuries that they witness, the treatments they're involved in providing. So there's a very broad definition that's also very specific, because this injury is a rather specific injury to our ability to move in and out of survival mode according to the circumstances around us. And instead, this injury pushes us into survival mode, or chronically keeps us in survival mode. Like you said, it doesn't matter who we are. It can happen to a therapist. It can happen to the smartest, most resilient person. It can happen in the Air Force and the Coast Guard and, all branches of the service. It can happen. Resiliency has been a watchword in the military for quite some years now. And the building of resiliency is certainly important, and yet still the most resilient person can suddenly encounter, honestly, what you guys and gals call, everybody's got their thing. Everybody's got that thing that's going to bother them.
Yeah, for sure. And it could be, like you said, it could be anybody. And even the people who, I've talked to people who have, maybe they deployed, but they never left the base, and they were that, like you're talking about, the medic who was just on the base, and they never went outside the wire. They never were on a patrol or anything like that. They were just working on their base, and that can happen to them too. All that type of stuff can happen to them just as easily as someone who's outside the wire every day, going on patrols and discovering, IEDs, or, getting into a firefight. It could happen to both of them just as equally. So it's good that I kind of cleared that up and got that information out there, right? But specifically, when we're talking about service members and the veterans, we often see that they are going to let their pride get in the way, or their ego, in terms of the treatment that they need. I think I was probably a good case of that, right? People like that, people like me, for example, might think that they just don't need to get help, that they'll be fine on their own, right? I can handle this. I'm tough. I can deal with this. Yeah. But then their loved ones might be able to see something that's not quite right. So how can a loved one, a family member, a spouse, a child, whoever, approach these people and let them know that they think it might be a good idea to go and talk to someone and get some help? What are some of the ways that these people can help their loved ones get the help that they need?
Oh, good question. And I always have a little bit of trouble shifting to that point of view, but who's going to be persuading somebody to go? Well, I'll tell you what. So I always ask, first thing I ask is, why now? It's been 10 years since you deployed, which, by the way, is kind of, in my experience, no research in this, just my experience, that it's 10 years post-deployment before folks report or come for a VA exam. Mm-hmm. So what did it take for that to happen? And the number one thing they say is, my spouse told me to do it,
Well, that sounds awfully familiar.
Yeah, I actually had a guy come plop down in my office, and this is like one of the stories I tell, because it happened several times, but one guy in particular, a Marine, he plopped down and he said, well, Doc, my wife thinks I got PTSD. I think I'm just an asshole. And so I said, promptly, well, I'll be the judge of that, which made us both laugh, quite a lot. Right. So, because agitation is one of those things, is like, that's what we think PTSD is. All right, you got your angry vet, that angry vet's got PTSD. Well, not necessarily. He might, or she might just be angry about stuff. But when there's PTSD, anger is always part of it, because I don't know if you experience this, like at least the thought, why is this happening again? Mm-hmm. Why can't I get a hold of it? Right. I haven't had a good night's sleep since 2006. Yeah,
right.
Yeah. And so, between the sleep disturbance itself can account for irritability and short temper, but you combine that with, why am I not sleeping? Because I can't get this off of my mind, or because I'm having nightmares about this a couple times a week or a couple times a month. Mm-hmm. Like that's the range. So what can a spouse do? Like before it gets to that ultimatum point, spouses see the sleep disturbance. So I think approaching somebody from the aspect of, man, I never see you get a good night's sleep. And besides that, you're interrupting my sleep with all this moving around and talking and, all this getting up to check outside, make sure that everything's square, and you did already lock that door, by the way. I think you don't have to go check that door again.
Right.
So these are they're so common. And a person feels kind of foolish when it's brought to their attention. So, wow, it's such a dicey situation for spouses to talk to each other about the impact of PTSD. That's a big reason I wrote the book, so that I could say, hey, find out some things to know about what PTSD looks like, so that you can set maybe a little more sensitively, a little less. I think spouses and families are kind of scared of this too.
Yeah.
I probably hedged that way too much, but I think everybody's scared of this. And I think we're going to be scared of this until we understand it.
Well, yeah, that's exactly what I was going to say, is that we're all scared of the things that we're not familiar with, the fear of the unknown, right? Like,
yeah.
That's a normal thing. And, until we have a better understanding on an individual basis on, what PTSD is and how it affects people, it is sort of a scary topic. I know when I first reached out for help, it was this big, scary thing that I didn't know what to expect. I didn't know what the treatment was going to look like. I didn't know if I was going to be, hauled away to some padded room somewhere. And I didn't have a clue what I was walking myself into with all of this. And, fortunately for anyone out there listening, there's no padded rooms involved. I was,
There are no padded rooms involved.
Right,
I have 6,000 exams. I never put anybody in a padded room.
Right.
And 30 years before that, or, all this, that sounds like a long time. But I'll tell you, I have actually put my career into this sort of by accident and then on purpose. And honestly, I think the other thing people are really afraid of is you can't get better from it. So why even address it? But if people didn't get better from this, I'd actually done something else with my entire life. So, I've seen people get better. Getting better means nightmares fewer and farther between. It means being able to tolerate going to sporting events again. Tolerate going to, mall. I don't know if anybody can really end up tolerating going to the mall, but you could, if malls are your thing, then, you could tolerate that too. I'm more of a skip in, buy it and get out kind of a shopper.
Yeah. I'm more of an Amazon kind of guy, but I get the
Amazon.
point.
Yeah. I do all my grocery shopping remotely now. Yeah. I'm not afraid of the delivery person. But being able to get out of the house without having to plan every step. These are some things, what recovery looks like. So I also cover that in this book. What does recovery look like? So that when a family member, a parent, talks to their service member about what they're seeing, look, this thing is getting in your way, man. This is keeping you from being the dad you want to be. This is keeping you from playing soccer on a soccer field, man. This is like making you look over your shoulder at every restaurant, so just kind of, again, with the pride bit, I think it's very hard to say to somebody, I see the effect on you. And you know what? You can recover from this. That was a big reason I wrote the book, was to be able to say, look, people do recover from this. It is a myth that people don't recover. The people who don't recover, why we have the myth, is because we have not had effective treatment until really recently, and so we just have seen people go on and on and on with this because we haven't quite known what to do with it in an effective way across all of the, say, mental health profession. But that gets into another topic. I can so easily go down sidebars on this topic because I like it so much. And I was just about to talk about all the other ways that you can address this stuff without ever talking to a therapist. So,
Right.
Yeah.
Well, I do think it's important that the family members of the loved ones who are out there, maybe it's not even family members, could be neighbors, coworkers, friends, whatever, that they know that there's something that they can do to help, kind of get them in the right direction, to nudge them towards getting some help. But there are steps, like you were saying, there are some steps that people can take to go down this path of recovery. And it is something that you can recover from, I should say. But the thing is, I think, I mentioned Amazon before. We live in this on-demand world where, you order something online and then like the next morning it's sitting on your doorstep, and, you want to watch a show, you pull up Netflix and it's there. You just watch it. And I think that we've gotten spoiled in a way that we sort of expect there to be this magic wand that you can just wave over someone and then magically just have their PTSD disappear and life is good and everyone goes on and lives a nice, happy life, right? But that's not the case. There's no magic wand that you can wave. And if there was, you'd be doing it all the time, and you'd be, rich beyond your wildest dreams, right? Because we'd all want that. We'd all be, knocking down your door trying to get.
You know what? In all these years, I have heard things come and go over and over again about this is the quick way. This is the quick way to deal with this, and even within my profession, in 12 easy sessions, you can overcome PTSD. No, you can't.
Right. Right. And because it takes commitment, right? And it takes openness and honesty with the person that you're speaking with. So what does a successful plan look like? What level of commitment is involved? What can people expect to walk into their first session and go through this treatment process, and what happens after those 12 sessions? How do they continue to work on themselves?
Right. Well, now I'm going to have to sit up, because it's a heck of a journey for people. I love what's been happening since I launched the book, like about 6 days. It was Memorial Day last year that we launched this book. And I love what's been happening because I've been having conversations with, people like you, Scott, and other veterans. And this question is always the question. The first session, people are, how long is this going to take? How long is this going to take? And so my answer to them became, ask me again in 6 months. And because in 6 months, we'll know whether 6 months was helpful, and by helpful, I mean, did it make these memories be less intrusive? Did you experience less anxiety or nervousness or even fear about safety in public places? In 6 months, we're going to know what the pace is going to be of how you're going to recover, because you are going to recover if you stick to it. Recently, it has occurred to me that recovering from PTSD is a lot like engaging in a physical, a personal training plan. How long does it take to get abs, Scott? How long? Huh?
Well, and that's one of those things. I hate the answer, but it depends is the answer. Because it depends on where you're starting from. You want to use that physical example of how long does it take to get abs? Well, if you have this big beer belly and that's where you're starting from, well, it's going to take a little bit longer than the person who's already kind of thin, but doesn't have that definition there. Right.
Right.
It's just going to depend. Each person's going to be different. And I like that analogy because it's true. The amount of effort that you put into it is also going to affect how how long it takes, right?
The kind of skills you learn, your willingness to practice those skills on a daily basis, or like, my personal trainer says 3 days a week, right. You have to do this stuff 3 days a week. I'm like, yeah, I still don't think I'm going to get abs, but that's okay. I might take 5, 6, 7 days a week. And there's kind of a funny way that physical strength is a really good analogy to say the strength to push back against how a trauma memory wants you to feel. And I think
that makes sense.
Folks who have PTSD know what that means. Other people are like, I don't get that, because they don't have the kind of memory that keeps haunting them. Right. They don't have the kind of memory that wants to push them into feeling sad or push them into feeling careful, or, so the daily practice. Okay, so what is the first session is like? A first session is about where are you in this process? Right. Do you know how to name feelings? Oh, that is a big thing for service members who don't want to talk about their feelings in the first place. Now I'm going to suddenly teach you how to talk about feelings. That could take a while.
Right.
Yeah.
Yeah, and you're absolutely right with that, because for the longest time we're basically told, okay, like just stuff down those feelings and just suck it up and do your job. And that was the message that we got for all these years. And now we're sitting down with someone who's saying, oh, let's open this package up and see what kind of feelings are inside. And it's like, I don't know if you want to open Pandora's box right now.
Yeah. And it is Pandora's box, because it does fly out and things get worse before they get better. This is the uncomfortable truth, saying the quiet things out loud. Truthfully, this, first month, 2 months, 3 months, look, it could be a while. The first quote unquote 12 evidence-based treatment appointments could just be all about opening the box and just seeing what's in there. And it's tough, because then you not only learn what your emotions are like, now you have to have other ways to deal with them. Then, you have to keep working out. You have to keep doing the healthy practices that you have, but you have to eat well. Good sleep hygiene. I mean, we start talking about the things that are important to physical health. They're also important to our emotional health and to recovery from PTSD. So a person like myself might say, I'm going to now teach you meditation. And a person like yourself might be meta who? I don't really sit still for 5 minutes, let alone, 30 minutes or, visual imagery. What the heck does that mean? And so really knowing your veteran population, knowing your military population, so important.
Yeah.
A big shift happened for me when I understood the kinds of routines and rituals that you all learn to shoot straight on the shooting range. Believe it or not, those kind of skills you learn to focus in to be able to shoot straight are the same kind of skills you can apply to refocusing when a trauma memory is bothering you.
I had never really considered that until just like 2 seconds ago when you mentioned that. But you're absolutely right. When you're learning to shoot, when you're shooting at any point, there's a whole lot that goes into it. It's not like Hollywood movies where you just, pull the trigger and just spray and pray.
There you go. And
like
hit stuff.
Shooting everything and you magically hit them, right? There's a lot that goes into it. You focus on your breathing, the sight picture, you're focused on everything that you're doing. You're in that moment, and anything else that's going on is like just irrelevant. You push that out. You focus on this one thing here
Yeah.
and now in this moment.
Yeah.
And that's like a really good way to think about it, is that level of focus that you had when you were first learning to shoot a gun, when you're sitting on that range and you're looking at that target out in the distance, and you have the your sight picture, you're breathing, and all the mechanics.
What's the first thing you do?
Right?
Deep breath.
You breathe. Yeah.
You stop thinking about the conflict with the spouse. You stop thinking about anything that's not happening on the range.
Yeah.
And you just focus in. So translating skills you already have into skills for pushing back trauma memory, I think, is the ticket. And it's certainly something that has been useful to a lot of service members, or, but at least the people that I've talked to,
Sure.
It was a while before I came up with that. So first I just had to know how to respond to the question, are you a veteran? Which is, no, I'm not. I've been in the rear, way behind the gear, way back home all of my life, right. Appreciating the work you all do. So, my thank you for your service is very well informed. Yes. And, but now that I know veteran, so saying this from the perspective of mental health providers, the challenge is to develop veteran competencies and military service person competencies, and being unafraid of crossing over skills that were useful in war or training to this battle against trauma memory, because we want you guys to come back home. That's what this is all about, how to leave the war behind us. So particularly I focus on combat, but so I'll just leave it at that for now. It's quite nuanced when you look at other kinds of trauma, like, assault related trauma. There's other ways to look at this, but honestly, for the veteran population, some of those, they already got those skills from the training. So the crossover and being able to help people cross those skills over back to physical training, personal training, and then doing it consistently, like learning, like disciplining yourself to address trauma memory in specific ways. That's what leads to recovery and not just management of symptoms. Yeah. Right.
I'd like to give you the opportunity to talk a little bit more about your book. You mentioned a couple times throughout this interview, and I want you to be able to give us a little bit more information about the book, PTSD Unplugged. What sort of resources are available in the book? What do you hope that readers are going to take away from it, and everything like that? And I believe you said earlier before we started recording that you had a part of the book that you wanted to read, here, and give you the opportunity to do all of that now if you still want to. That's cool. All good. Yeah.
Well, I'll say, look, I never wanted to write a book in my entire life, actually. But what was happening was, it was 2019. And I had been doing this since 2008. And I was talking to OIF, OEF vets who were internet savvy, or maybe not. I mean, actually, a lot of vets don't really care about any kind of social media or whatnot. Yeah, I get that too. But still, you know how to look up if you got a temperature and sweating, and now we're looking that up to see whether we got COVID, something. Right? Do I have the symptoms? And this is not something that veterans were looking up.
Okay.
I just started asking, have you ever looked this up online? Like you can actually Google evidence-based treatments for PTSD. You can Google or you can look up the National Center for PTSD, which is a VA organization. So I started saying these things to veterans over and over again and going home and complaining that even our young vets are not investigating what this is, to the point where my friends and family were like, it is time for you to write a book. All right. Yeah. So I got talked into it. And it was the best process for me. It was the best thing for me to do. It took me about 6 months to write the book, and then a year and then COVID hit, and then we edited the book. So the first thing I want to say about the book is it's this thin. Let me get this. That's how thick it is in written form. All right.
Yeah.
Now
pretty
on.
Thin. Right.
All right. My son, who is like my best fan and best critic, told me it took him 3.5 hours to read it.
Okay.
So I'm like, okay, good. That's good. You know, the font is a nice size. And it starts at the beginning saying why I wrote the book, which was just to get all the information in one place in a vet-friendly way. You know, so this is the conversations I had with 6,000 vets in one book. All right. Starting with, and also I also collaborated with a person I met along the way whose grandfather was a paratrooper at Normandy. So it starts with her depiction of her relationship and rapport with her grandfather, and how his PTSD symptoms, which of course weren't recognized as such, but led to such alienation in his family. So the goal in writing this book is to inform vets and their family members about PTSD, to reduce the alienation, to lower the stigma, to say to our veterans that, look, we can see it, you can see it, let's do something about it. So then this is the part I was mentioning earlier, that when I finally get down to it, it's chapter 2 in the book. PTSD, what it is and what it isn't. And it starts off with violence leaves more than just a memory. The most important thing to know about PTSD is what has been happening in your brain since you experienced that life-threatening event. While your thoughts and feelings about that day grab your attention, trauma memory is what's been grabbing your brain. Trauma memory, that horrible moment in time that was frozen in time. Violent, life-threatening events impact your brain like a sledgehammer. They demand that you shift into self-protective survival mode. Then a neuropsychological bubble forms. Now, so this is what I liked about writing this book, is I could use fancy words. So a neuropsychological bubble forms in the amygdala. It's a part of our brain that tells the rest of our brain what's happening. It pulls in the sight, sound, smells, tastes, things we feel, fears of the moment, and puts them in a bubble. We don't know why this happens, but that's trauma memory. And what we know is that it happens at least 20% of the time. So that 20% of the time we experience a trauma event, or let's say 20% of combat vets are actually already diagnosed with PTSD. 500,000 of you guys. It's a lot. And every guy who comes in tells me about 2 or 3 guys and gals that they know. And not just guys, it's also gals, but you know, such a heavy percentage of men who are affected this way from combat. So I often revert to saying guys a lot, but it's men and women. So you just multiply that out, and that's like 1.5 million. You know, that's a lot of people. And our suicide rate is horrible. So why did I write the book? I wrote the book because the war is haunting our service members, as war has always haunted warriors, always. Right. You know, it's just we're in a situation right now in our culture where instead of our communities gathering around and embracing that warrior, we're telling that warrior, you have a medical condition, go see a doctor about it. Like, you know, you went to war for me, come tell me about it. Mm-hmm. And yeah, so when you get to chapter 9, you've learned enough about PTSD that if a warrior comes to you, you'll know what's going on. You'll have some idea of what to say, or more importantly, what not to say, and,
Right.
I mean, this is such a uniquely different thing, that the common ways that we comfort people actually make people feel less like talking. And really, it's just more valuable to listen and to repeat the message over and over again. I understand why that keeps bothering you. I get it.
Right.
I think that might keep bothering me too. So there's also, there's some specific tools that we talk about in the book about how to have good conversations with people about not just war, but other kind of trauma events. And again, this process of being out in social media and talking to so many people. We've got a website, PTSD Unplugged. I have a blog on there that I get to keep writing now. I'm actually happier about writing blogs than I was about writing the book. So we've got some tools out there. I've got a tool on there that is about talking about or writing about what happened in a way that is helpful. Not just blurting it out and then tossing back a couple shots, but
Right.
it's something that's helpful.
Yeah. Because that tossing back a couple of shots is probably not the direction that you want people going. With their recovery process and everything.
Yeah.
And we do a great job at doing that in the military, where we kind of cover up some of the pain and everything with things like alcohol and other substances and stuff. But it's sometimes the pain, you need to kind of face it head on and really address the situation, not just mask it with drugs or alcohol or whatever, other risky behaviors and things like that. So I really do appreciate the fact that you first off put this book together and are continuing to help the veterans who are suffering with all of this, but really having the book there for the people, the family members who might not know really what's going on with their loved one. That they can pick up this book and get a better understanding. And like you said, in a few hours, you can read this book and get a better understanding of what's going on with your loved one, and how you might be able to help them in a constructive way. If you're not able to necessarily help them yourself, but you can at least nudge them in the right direction. Get them to seek the treatment and everything. And this gives you a better idea. Is it even PTSD that you're talking about with this person, right? But at least you can try to understand a little bit more of what's going on with the person. So with that, I think that's a good place to wrap this one up. But it has been a pleasure speaking with you today. Thanks, about Scott. All of this. I really do appreciate you taking the time to come on and share your book and your background and everything else about PTSD. It's a really important topic that I'm really excited that you were able to come on and share about this. I know you mentioned your website, the PTSD Unplugged.com, but is there any place specifically where people can go to get in touch with you and get a copy of your book?
Oh yeah, I should probably say that I'm a terrible bookseller. We're on Amazon. Okay. So we're in Kindle and hardback on Amazon. You can also find us on Barnes and Noble and some of the other ebook formats. We first launched through Smashwords, which got us out to 4 or 5 different platforms. People use Nook and Mobi and other things like that. So that's where you can find the book. If you go to PTSDunplugged.com, there's a buy the book tab that takes you to Amazon. We're not yet in audiobook format, but it's on the horizon. Let's say by summer, maybe sooner. We'll get the audiobook together. So that's there. And then the extra resources on PTSDunplugged.com, where we have a resource page that we call Stronger Together. Has the national resources that people may or may not be familiar with. And we're trying to build a mom and pop type resource, links there for boot camps and emotional support animals. There's a guy who does PTSD scuba recovery. So for free for vets, you can go scuba dive for a couple weeks, and they're having some great success, because this is what takes you out of the memory, is getting you into the present. Getting you out of the past, getting you anchored in the present. And you can recover from this. It takes longer than anybody wants it to take. It takes more work than anybody wants it to take, but anything worth doing is worth getting into.
Right, exactly. Yeah, it does take time, but it's worth it in the long run. When you start seeing the results and having the the benefits in your life and in your family's life and helping out along the way, it's definitely worth the effort. So
yeah, you deserve to come home from all this crap that you experienced, and we want you to. So yeah. Thanks for sharing your platform, Scott. I really appreciate it.
Absolutely. And I again, thank you for joining me. Thanks for coming on the show.
Sure.
Thanks for listening to the Drive On Podcast. If you want to check out more episodes or learn more about the show, you can visit our website, driveonpodcast.com. We're also on Instagram, Facebook, Twitter, LinkedIn, and YouTube at Drive On Podcast.